Hi, I'm Dr. Dean van der Westhuizen. I'm an eye surgeon in Mbombela in South Africa, and today I want to discuss briefly what glaucoma is. Glaucoma is a relatively common eye condition, and it's one of the most common causes of irreversible blindness. And it's important to understand that it's irreversible. Once you have vision loss from glaucoma, one can't reverse it. One can't improve the vision once you've lost vision from glaucoma. So it's critical to understand that glaucoma is all about prevention. We want to stop the vision from getting worse. And to do that, one has to detect that you have it. And glaucoma is silent. You won't know it, you have it, unless you've had your eye pressure tested and you've had your optic nerve assessed. Because it may run in families, often we pick it up as patients are coming in because their mom or grandmother has glaucoma, but it's really important to have your pressure checked to ensure that this isn't something that's developing in your eye. When we talk about glaucoma, people talk about pressure because yes, it is pressure related, but that's not all there is to it. You can imagine the eyeball being a little bit like a soccer ball, that the ball is under pressure. A soccer ball, you can pump up too hard and it can be too stiff, or it can be too soft. So there's an ideal pressure that your eye has. It's not your blood pressure. That's often a confusion. People think that blood pressure is related to this. We're actually measuring the pressure in the eye itself. How hard is the eye? Now, that pressure causes damage to the nerve. So right at the back here, high pressures lead to damage of the optic nerve. And that damage, this nerve is made up of millions of fibers, and those fibers slowly die. And as those fibers die, this nerve fiber layer gets thinner and thinner, and as it gets thinner, the vision deteriorates. Now, the vision doesn't disappear in the center. What happens is the peripheral vision disappears first. So it's often patients are unaware of that. And as the disease progresses, the vision closes in, until you have what we call tunnel vision, where you're looking through a small section there, and then eventually the vision disappears in the end. So normally patients, if they become aware of it and their vision is deteriorated to a point where they're struggling to see, it means they've already got advanced glaucoma, and you've already lost a lot of your nerve. So we really want to get patients before they have advanced disease. Normal pressure in the eye is between 10 and 20 millimeters of mercury, roughly. And so if we measure the pressure high, we get more concerned. If your pressures are between 10 and 20, we're normally more relaxed. But it's important to understand that pressure doesn't determine the diagnosis of glaucoma. And this is quite a common concept. People think if their pressures are normal, they're fine. If their pressures are high, then they definitely have glaucoma. And that's not the case. What determines whether you have glaucoma is whether your optic nerve is affected. That's what's important. So if you've got damage to your optic nerve, then we know that you have glaucoma. Because some people can have high pressures, let's say someone with a pressure of 25, and their optic nerves may be normal, and we call that ocular hypertension. That means they don't have glaucoma, which means the pressures are high, but they still have a normal nerve. And then other patients can have a pressure of 16, 17, which would be considered normal, but then we find that they have glaucoma, and that's called normal tension glaucoma. So you can have high pressures and not have glaucoma, and you can have normal pressures and have glaucoma. So pressure doesn't determine whether you have glaucoma. The pressure helps us guide us what we must do once we know that you have glaucoma. So it's really important that you have your pressure tested, but then also have your optic nerve looked at. So the way we assess for glaucoma is we physically look at the nerve at the slit lamp with biomicroscopy. We assess the optic disc. The other thing we do is we do an OCT, which is a scan of the nerve and the retina, and we can measure the thickness of that nerve and see if there's any signs of damage to it. And the third thing we do is we assess the visual field. So there's a test that we do to assess where you're seeing. That's a functional test of glaucoma, and if we can see any patterns that are in keeping with glaucoma. So those three things together, observing the disc, assessing the disc on OCT scan, and visual field testing, together with the pressure, will help us know whether glaucoma is the likely diagnosis and whether one needs to treat it. Treatment is typically with eye drops initially, but SLT laser is a common intervention early on nowadays, and then there's surgeries for advanced diseases or patients who are not responding to more conservative treatment. if you have a diagnosis of glaucoma made, or if we diagnose the eye with having glaucoma, the next step is to drop the pressure. And that's essentially what all intervention is. It's about decreasing the pressure to a level for that eye that is safe to prevent the eye from progressing. All the treatment doesn't reverse it. Any damage that was done has been done. All the interventions, whether it's topical drops, laser or surgery, the goal is the same, to drop the pressure to prevent the eye from getting worse. And every person has a different pressure target. So we talk about target pressures. What pressure should your eye be at? That depends at what your starting pressure is and how your eye is doing. And as we monitor the eye over time, we can help determine more what your target pressure should be and what is ideal for you to prevent your eye from deteriorating further. But that's glaucoma in a nutshell. I hope it makes sense and I hope it was helpful.